I think we are up for our afternoon discussion and integration of networks. We're going to start with kind of a presentation by our each of our centers, kind of defining what we see the vision of MPRINT 2.0 would be, or where we need to go in the next 5 to 7 years. It's going to be led by Dr. Rob Bies from the University at Buffalo.
Sorry, great. Thank you, Sarah. So I think this is going to be an exciting discussion. We're going to really take the structure of this next session is going to be 3 relatively short talks from each of the centers to frame some of this vision with feedback from the panel. We'll have a short break, and then we'll have a panel discussion where we have some structured questions, and we look forward to the conversation. So I'll start by requesting that the panelists assemble on the dais here, or on the stage here, as I introduce them, as they'll be asked to give feedback after each of the talks. So our first panelist is Nahida Chaktoura, who is the branch chief for the Pregnancy and Perinatology branch, the Eunice Kennedy Shriver National Institute of Child Health and Human Development. Okay, maybe she's done. It's night. All right, well, I'll go ahead to the next. Our next panelist is Majed Constantine, who is the Frederick P. Zispon Professor and Division Director of Maternal Fetal Medicine at The Ohio State University. Our next panelist is Rachel Greenberg, who is an associate professor of pediatrics at the Duke Clinical Research Institute and the director of the Pediatric Trials Network. Prince Carroll is the Richard B. Johnson Jr. Endowed Chair in Pediatric Research at the Vanderbilt University Medical Center. Almika Fuma-Fletcher is the clinical pharmacology policy lead for pediatric and maternal pharmacology at the U.S. Food and Drug Administration. Sharon Nachman is the chief of the Division of Pediatric Infectious Diseases and the director of the Office of Clinical Trials, distinguished professor of pediatrics at the Renaissance School of Medicine, Stony Brook University, also the PI of the Impact Network. Sarah Quenney, as director of the Disease and Therapy Response Modeling Program, the PI of the MPRINT, and of course, professor at Indiana University School of Medicine. Xiaoxia Ren is the senior program officer for the Obstetric and Pediatric Pharmacology and Therapeutics branch at NICHD, and also had established the Translational Research Program there as well. And then Adriana Tremoulet is a professor of pediatrics, associate director of the Kawasaki Disease Research Center, the assistant vice chancellor for health sciences faculty affairs at the University of California, San Diego, at Rady Children's Hospital, San Diego. So please welcome our panel to the stage. So the first presenter for the first session will provide a vision for UCSD, and that's distinguished Professor Christina Chambers in the Department of Pediatrics, the Chief of the Division of Environmental Science and Health, and the co-director of the Center for Better Beginnings, and the Associate Director for the Altman Clinical and Translational Research Institute at UCSD.
Thanks, Rob. This is pretty intimidating. So other members of our team who are here today, Shirley Sunoda and George Liu, if there are questions, there are plenty of questions that I can't answer, they can answer, hopefully on my behalf. Let's see. Okay. Thanks. So we did have a chance to brainstorm over the last couple of weeks, but I think we've gotten a lot of ideas here over the last couple of days about other opportunities. But based on our conversations prior to this meeting, we'll give you a couple of ideas. Good?
Tina, can we share the slides on Zoom, please?
Yeah, I just need to see it on this